Welcome to the new H1 podcast, Towards Health. I'm Josh Pirtle, Creative Director for H1, and today we're speaking with H1's co-founder and CEO, Ariel Katz, about the early development of H1 and where he envisions H1 will be in the future. Ariel, thanks for joining me today.
I'm excited to be here with you, Josh Pirtle.
I mean, you're guest numero uno. What an honor.
It's a place to be.
Exactly. Heck yeah. If you don't mind, the millions of listeners who are listening, can you give a little background of just kind of like who you are and how you got started?
Like, how far back do you want me to go?
I would love to know about third grade.
Oh, got it. Okay. Third grade was no, third grade is when 9/11 happened, actually. That's very and I remember that that's my one memory from third grade, as well as not understanding how to do long division. I was failing out of long division, and 9/11 happened in third
Do,
grade.
do not get me started on long divisions, sir. How about college? How about college and to present day?
College to present. So I went three colleges in 3 years because I felt like I wanted some diversity. I went to the University of Pittsburgh my freshman year, then I went to Hebrew University, and then I went to Binghamton University. So Pitt is in Pittsburgh, Hebrew is in Jerusalem, and Binghamton's upstate New York. I'm from New York. Um, I had three majors in 3 years as well, which is the way to do it.
Holy
So,
moly! What were
right.
those?
Finance, finance major, economics major, psychology major.
Holy
Uh,
smokes! Which one did you
that's
like most?
uh, None of them actually. I didn't mind psychology.
Yeah,
Um,
I think I'd like psychology too.
uh, that was college. College was weird for me because with college you normally like develop a social life, and it's hard to develop friends. College is not a year. College is 3 months followed by a 2 month break followed by 3 months,
Yeah, very
um,
true.
and then a summer. And so it's hard to develop relationships and friends. And at that age, you're still like finding your identity. And so that was like somewhat hard from a social perspective. I remember it was the most like hyper motivated I've ever been in my entire life. And I tell people like people say, "Oh, you work hard these days." I'm like, "You have no idea. I was working 7 a.m. to midnight every day, 7 days a week, basically from junior year for like 10 years since then."
I
And
feel
those
like
were
a
the
lot
early.
of it sounds like a lot of like very successful people have a very similar story. Just like when you're first starting out and getting the grind going, it's just a very very intense work habit and drive and I mean I feel like I hear that story a lot with especially like entrepreneurs for sure.
Yeah, it was crazy those days, and it was just so like I don't know where it came from honestly. There's like an internal drive. Where I was like driving very hard those days.
Did you do well? Did you do well? You didn't have a drive like that in high school? Like, how was your?
Oh, high school? No, I was failing out of high school. We looked at my wife and I looked at my report card. I got a couple D minuses in a lot of classes actually.
Wait, did you say B? Did you say B minus?
D minus,
Oh, okay.
D,
I was like,
dog minuses. I started off my freshman year of high school with a couple C, like straight C's, and then I got better in a couple subjects, but it was pretty consistent between like a D and a B in most classes.
all right, cool. So we share similar high school experiences. That's good to know.
So
Good to know.
didn't do too well. School wasn't my thing, and then the biggest issue was I always thought I was the smartest person in my grade, and nobody else thought it, and my grades didn't reflect it. But there's only one way to judge someone for the that thing, and I always thought nobody understood it. Nobody understood me, and so I was
I
so
feel like I'm the smartest person on this call, but I don't think anybody else would agree with me.
that's how I felt in high school.
Good. So I can relate. Um, how about can you tell me like why did you start H1? What made you start H1?
So after we had sold Research Connection, myself and a smaller group of the guys that were on the team, we were debating. So you always want to hear like, I was walking down the street and an apple hit me, and the idea of H1 came about. It's not actually the way it worked. The way it worked is we were like heavily debating what should we do with our time, and the argument I gave was like, look, we don't understand much things about the world and life, but we really do understand how medical research is funded. And like we're probably in the top 50 people in the world that understand how that works. And it's a pretty big market and it's an impactful market. And compared to everything else, from like plastic bags to water to glasses to electronics, I don't understand any of that stuff. But I understand this one thing. And if I understand this one thing, I think I could build something unique. And so that was the argument that was used. And everyone's like, no, you understand how to walk and other things you do in life, but I don't understand it as the most. There's more than like 10,000 people that understand it better than me. I knew I was in the top 50 people that understood this thing. And so we could build something if you understand it. So that's why
Wow,
we started in this category where H1 started back in the day.
that's amazing. Um, so H1, we recently got a new round of funding and a new acquisition of faculty opinions and clairvoyance. How does this add to the overall vision of H1?
Yeah, so it's all the same pieces to the puzzle that we want to fill in. The puzzle that nobody in the world has today is a trustworthy source of doctor information and healthcare information. So now we're really good to go. And especially with fake news and what you're Googling these days and vaccine, like there's nowhere that you really go to. If you want to find out a good restaurant, we all go to the same place. You want to get from point A to B, you all go to the same place. You want to find out a good song to listen to, we all go to the same place. And it's crazy you don't do that for healthcare and your personal healthcare, and it's true for pharma companies that don't have one place to go to. And so what clairvoyance adds to the picture is understanding which doctors in America are doing certain procedures, so that if you have a medical device, who you can bring that device to so it could reach patients. What faculty opinions brings to the world, and why it fits into our picture is what do the top scientists and doctors think about the latest medicine and science? It's great. It's great to know everything about Dr. Josh Pirtle. What if you knew what Josh Pirtle actually thought about the latest medicine and science? It gives you a whole different picture. And what does the community think about the latest medicine and science? And so clairvoyance faculty opinions just fit into the broader picture that H1's trying to fill in the world.
If I could sidestep here, my chief complaint when I go to my doctor's visit is that I wait 45 minutes in the waiting room, and then I wait 30 minutes in the room, the actual room, waiting for the doctor, and then he's like ready. He's done with me in about 90 seconds. Do you have similar experiences?
I don't. You should find a better doctor.
Dang it. Maybe it's just me. Maybe it's just me.
That's a Josh Pirtle thing. I don't think it's probably experienced with a lot of people, but I think that's also like a
What's
changeable
the
thing.
hurry, buddy? I've been waiting to see you for like 2 months, and you talked to me for like 90 seconds. All right, maybe that's just a me thing. Okay, we gotcha. Um, the what has gone differently through that you thought that when forming this company, what was some of the mishaps or some of the unforeseen obstacles that you faced that really like kind of caught you off guard?
So the craziest one that happened was early on. You know when you like buy a shirt and you're like, ugh, I wasted $40,
Yes.
or when you buy a lunch and you're like, ugh, this lunch is terrible. I wish I didn't
Tell
buy
me
this.
about it. Yep. Mm-hmm.
Okay, so you're like, oh, it's like a $10 mistake or a $40 mistake. I made $1 million mistake, and
That
over a
that
million, like
was
1.2,
that sounds like
1.4
a
million.
very nice shirt. Sounds like a very
It's a
nice shirt.
very nice shirt that I
Okay.
purchased.
Okay.
And when I made that mistake, I was like, holy crap, that's crazy. That's a ton of money. Uh,
Yeah.
a lot of money.
Uh,
And
how long did that sit with you?
so we have one of our best investors is Menlo Ventures. And one of the investors there, he said, the reason why you raise a round of funding is it allows you to flip over cards. If you have $10, you could flip over 10 cards.
Mm-hmm.
And you could see what's under it and see if it works. If you have $20, you flip over 20 cards. The numbers just get bigger and the cost of flipping over a card gets more expensive. But he articulated that way as like, you don't need all the cards to work out.
Mm-hmm.
You
Mm-hmm.
need a few of them. And if the few of them work out, that's all that matters.
That's great.
If you have all them work out, you probably got lucky to a degree. So changing it from like look, there's many restaurants you could go to. You could get lunch at all five of them.
Mm-hmm.
You don't need to have five favorite restaurants. You only need a couple. And once you have those, you just double down on those. And so I learned early like it's okay to make those types of mistakes as long as you like cut them off really quickly and reallocate it to what you do like.
Mm-hmm.
Um,
It always
so
seems like life's lessons are always best on the mistakes you make, or like failures. You kind of learn the most from some of those sometimes.
you'll learn a lot from those failures.
Yep.
Yeah, a lot of
you
scars, for
need you
sure.
need to, right? You need exactly what you're saying. You need to flip over all the cards to see which ones are going to work in your
Yeah.
benefit. Since this is the first episode of the H1 podcast, Towards Health, Steve Jobs describes a brand as being about values versus a product. What values does H1 stand for in its brand and vision?
So I think the values that, I mean, we have company level values, which is the way that how we want to work with each other to achieve our mission. And I view that as different as like what we want to stand for in the products that we create for the world. In the products that we create for the world, we want people to understand that H1 comes with a level of like trustworthiness, humanity built behind the products, uh, expertise and knowledge. And so when you use an H1 product, you know that there are people behind it that have deep expertise, and it's something you could trust, which is critical when it comes to healthcare. It's not like a social media app where it's like, oh, whatever. But like you want to know those things when it comes to healthcare.
Yeah, that's awesome. Great answer. Where do you see H1 in 5 years? What is the future of the innovation of H1, or where do you hope to see it?
I think there's going to be about 7 billion users, and I think we might hit like one out of those 7 billion in 5 years. I'm actually serious. In 5 years, there should be like one out of 7 people on this earth would touch H1's information on a monthly, daily basis in different ways. But they'll all have access and be touching it. Um, and I want the world to have a place to go to when they're trying to find out healthcare information. It's there's nowhere to go,
Hmm.
and there's nowhere you can trust. It's funny. I actually spoke to the CEO of WebMD earlier this week, and that's actually they actually do good work, but it's for very. I have a cut. What do I do? My kid's crying with this rash. You don't go to WebMD if I just got diagnosed with phase 3 lung
Right.
cancer.
Hmm.
It's a whole different ballgame, and there's nowhere to go for that right now. So a lot of questions are still left unanswered for patients.
Final question. I think we chatted about this a little bit, but who do you think's going to win this series? Celtics versus Heat.
So you never bet against the best player in a series,
Oh, nice. Okay. Is
and
that
so
is that your stance on all sports?
stance. And I would have been wrong in the last 2 series with the Giannis and whatever. But that's my stance. You never bet against the best player. So it depends on the team. So it depends on the sport. It depends on the team. A game like basketball, one player can win a game by themselves. In other sports, it's more of a team sport. Like for example, in football, there's so much interdependencies on things. Whereas basketball, 1 to 2 people could just win a game and put them on not a series, but one game. And so you never want to bet against. I never want to bet against the best player. And so I'm gonna go with my boys, the Miami Heat.
Heck yeah, good stuff. That's the wisest words I've heard all day there. Real good stuff, buddy. To learn more about how your organization can partner with H1 to gain insights into the single source of truth about medical professionals globally, visit h1.co. Don't forget to subscribe to the show, and we hope you enjoyed listening to the very first podcast of H1's podcast, Towards Health.